started the Tea Party WDC back in February. And I have a small insurance and financial services business, and I'm familiar with the subject today, which is the cloture vote that the Senate wants to basically pass the health care bill, and this is their means of doing so. So I'm here to protest not only the seizure of my industry, but also the destruction of our healthcare industry. Some of the things that are in this bill is that they would tax wages, medical devices, prescription drugs, sick people, health insurance premiums twice, health savings accounts, flexible savings accounts, health reimbursement arrangements, and cosmetic surgery. The remainder would supposedly come from $491 billion of Medicare cuts, even though the Medicare's chief actuary says it is unrealistic. And considering that approximately 1 out of 3 dollars is spent on fraud and waste in Medicaid, Medicare, and veterans benefits, really they should be going the exact opposite way, away from monopoly and towards competitive markets. As a matter of fact, is there anybody here, without identifying him, just say hurrah, who's in the military right now?
Hurrah!
Okay. Well, ultimately, I think that the best gift we can give our soldiers is fully portable benefits anywhere in the market. If they want to go home after they've served their country well, and they don't happen to have a VA hospital in their town, they should be able to go home and go to the doctor that they had when they were young men or young women.
Anything they want.
One here in Washington, D.C. is one of the worst there are.
I agree. I agree. And I've been inside VA hospitals, and some of them are absolutely deplorable, and I think we should not be treating our veterans this way. So in addition, the biggest hidden cost is the private sector mandates. In Hillary Clinton's, or Bill Clinton's health care bill, as well as in the Massachusetts bill, it's the mandates, making everybody part of that, the health insurance monopoly, that has increased the cost by 60%. So they're going to cut back on coverages. They're going to deny people the ability to have Medicare Advantage, which is just a wonderful way of having your own doctor who you've had a relationship with maybe all of your life. So basically, when you add it all up, it's about $2.5 trillion. They're going to tax us for 4 years before even beginning to service this monopoly. And then they've only accounted for 6 more years. So we're going to run out of money. And of course, that's when rationing comes. So basically what they're doing is and I know this sounds harsh, but they are voting to become our executioners, both of the unborn and the born. So, well, everybody, man, woman, liberal, independent, Republican, conservative, whatever label you go under, whatever way they have divided us, we must unite together, because this free markets is the only way to provide the most opportunity for the most people. It's the only way that we can conceivably get the best education, get the best health care, get the best energy cost, and produce a huge amount of jobs just by privatization. So thanks for listening, and you guys have a great day, and I hope to see you at the next Tea Party.
Can I ask you a question, Lisa?
Sure. Yeah, sure.
Lisa, I have a question.
What do you think the possibility of corruption will be under the proposed universal health care from a standpoint of who gets treatment and who does not? Is it possible, is it conceivable that in the future that one's political orientation would determine if you get life-saving care or not?
Absolutely.
Yes, and you have to remember that sick people often don't vote. All right, so let's just say that those that can't vote are going to be considered, well, useless. And they'll be the first ones, of course. The fact that they're taxing sick people who more than likely can't work and can't defend themselves and can't certainly go out and do grassroots organizing. We're here for the sick people. We're here for those people that can't defend themselves.
Can you explain that? When you say they're taxing sick people, can you explain what you're meaning?
Their services, whatever they might be, sick people need medical devices. They pacemakers, exactly. And you name it, and it's going to get taxed. This is not a sustainable plan, so they're going to crank up the taxes. And here's the problem with political decisions. when they make political decisions about where they put money, they're not saying we're going to keep X amount of money. So for each person, you're going to have $8 million worth of coverage. No, every year.
Let me come on that.
Okay.
I'll give it back to you. But
Can you turn towards my daughter so she can hear me?
I don't know. I'm sure most of you are familiar with the fact that when they talked about Medicaid and Medicare, it was all supposed to go into a lockbox. Has anyone found that lockbox lately? Yeah, it's been in someone's refrigerator. That's perfect. That's exactly right. William Jefferson's refrigerator. That's a good point. Yeah, go ahead.
Look, $1 out of $3 already is waste and fraud. Monopolies don't have any incentive whatsoever to perform well, to make it convenient to us, to control their costs. And of course, every time a budget is made, they can decide whether they're going to fund it or not. And so every year, we are literally going to have to fight for our lives. And this is not the way that we intended under the Constitution to live. The purpose of this country was to promote life, liberty, and the pursuit of happiness. Having to fend your life every budget period is not my definition of happiness, especially when I am perfectly capable of paying for my own coverage, as well as the taxes, reasonable taxes, for a functioning limited government. This is all bad news, and we need to remove these people from both Congress and Senate.